FirstCare, one of the challenges that we face is being a health plan. We have to deal with enrollment files from many different groups, many different people, companies. And because they're our customers, we basically tell them, look, you can send your data pretty much in any format you need to send it in, and we'll handle it on our end. And that's where Pervasive is really great, because it doesn't matter what kind of garbage they send us, and a lot of times it is garbage. We can use the Pervasive mapping tools to deal with the data. And so it's really flexible. It allows us to be flexible with our customers, because we don't have to make them enforce some kind of standards or whatever. We can just say, just give me whatever you got, we'll take care of it. And so that's one of the big uses right now.
And we barely scratched the surface, but we're just starting to think about using Data Profiler as well. Our major challenges, usually it's just the complexity of what you're trying to do and breaking it down to the individual piece of work and understanding what that is and how to accomplish it. It can be very complex, but Pervasive usually pulls it off.
Well, there's several. The one would be the electronic enrollment process, kind of what I mentioned before, with basically where we get feeds from all different customers, all different groups, and we have to be able to enroll those. We have to be able to take all different types of data, whether it be Excel spreadsheets, ASCII fixed, ASCII delimited, XML, 834 enrollment files, what have you. We have to be able to take that data and get it into a one specific format, so that our back-end claims processing system can take that data and load it up. And so that's basically, I guess, one of the main ones. We also have, there's some 837 processes where we basically have to take both inbound 837 data in and write it out to like SQL databases, and where we have to, the reverse, basically take data out of several SQL databases and create 837 encounters outbound to the state. So those are a couple big ones.
And then what I've been dealing with more has been one-time migrations for loads to different. In the healthcare business, there are a lot of applications out there, and so I've done a couple of different loads for specific flat file formats that are pretty complex.
The data volumes that we deal with can vary. If you're talking about 837 claims, I think we get around maybe 30 or 40,000 claims a day. If we're talking about like the monthly feeds that we have to send out, sometimes it could be like millions of records. So volumes, they vary greatly. Well, I think the way the company benefits from Pervasive is because it just makes our jobs easier, in the sense that it's quicker to be able to create an 837 file outbound. You're not having to write a bunch of custom code to do it, or do it in a .NET program. So instead of taking perhaps months to create an 837 outbound file, you can do it in days. So it's just speed, to deliver is basically one of the big.
They also benefit by the presence of Byron and I.
True. My favorite would be the ease of use, the amount of different types of data it can connect with, the fact that it really doesn't matter what somebody has. If I've got this file, I need to be able to transform it into something else. I was like, don't worry about it, I got it covered, And so it's just basically just the flexibility, the power, and the ease of use.
I'm very interested in the data cloud. Working with the data cloud is, I don't know if we're going to use it at FirstCare, but it's just interesting technology to me. And I think that down the line, especially when there becomes, when the invoker for the data rush engine is going to be available in Process Designer, I think that's going to be useful to us even at FirstCare. I think it's going to be good.
I'd like to get more swag at the users conference. I was really disappointed in the past 2 years with the lack of swag. The first year we got these nice little You know,
USB keys.
USB keys and various different swag. And
Bag.
yeah, just a little bit disappointed there.
Now we got a pen.
A pen, yeah, that's just not cutting it.